Good afternoon, everyone. I'm Cheryl Mencken. I'm the Research Manager at Autism CRC, and I'd like to welcome you to today's webinar, the final in our Autism Month webinars. Today, Dr. Kiah Evans will be providing an overview of the research project underway to develop Australia's first national guideline for autism diagnosis. This project is being completed in collaboration with the National Disability Insurance Agency. Autism CRC aims to harness existing knowledge of autism to ensure earlier and more accurate identification and diagnosis. Developing a national guideline for autism diagnosis is a key initiative towards achieving our aim. Before we get started, I'd just like to go over a few items so that you know how to best participate in today's webinar. You're listening in the computer system's speaker by default. If you would prefer to join over the phone, please just select telephone in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit text questions to the panel by typing your questions in the question panes of the control panel. You may send in your questions at any time during the presentation and we'll collect these and address them at the end of today's presentation. So Dr. Kiah Evans is the project coordinator for Autism CRC project to develop the Australia's first national guideline for autism diagnosis. She's the program manager for the autism research team at the Telethon Kids Institute. Prior to this, Kiah was a researcher within the Curtin Autism Research Group, where she was involved in evaluating the specialist peer mentoring program. Kiah is an occupational therapist who completed her doctoral research on how working mothers and carers balance their multiple roles. She's worked as a lecturer, researcher and project manager within an academic setting, along with a range of public and private work within the rehabilitation sector. Fresh from 4 workshops around Australia to consult with the community around autism diagnosis, Kiah is here to join us today. Thank you for making the time, Kiah.
Thank you.
Before I hand over to Kiah, I just remind you to please write your questions for Kiah throughout the webinar. We'll be compiling these and we'll have a Q&A session at the end. Thank you so much, and over to you, Kiah.
Fantastic. Now hopefully that screen is coming up.
Yes.
Fantastic. So thank you everybody for joining in the webinar today. What I'm hoping to do is share with you the background of why we're doing the National Guideline project, how we're going about creating and finding the evidence and developing the guideline, and what we've found so far in terms of some of our early preliminary results. So in terms of background to the project, as many of you may have seen in the last few weeks, the Australian Bureau of Statistics has released new information about the prevalence of autism in Australia. According to the ABS, there's somewhere in the range of 164,000 Australians who are currently diagnosed or identify as having autism. Within the statistics, they talk about there being a 42% increase over a 3-year period. One of the things with that statistic to keep in mind is that that's relative to the population also increasing. When you look closer at the details, it's an increase of a 0.5% rate increasing to a 0.7% rate, which keeps Australia fairly consistent with prevalence in other similar countries. One of the statistics that I know has been one of the topics that's been spoken about in the other webinars this week is the gender difference in terms of prevalence. So we're looking at somewhere around a 1.1% of the male population versus a 0.3% of the female population. And I know that there's been some discussion earlier this week about whether that is also reflective of different presentations in the diagnostic process. So that's something that in this guideline project we're really keen to examine and to make sure that equity is in place. One of the other things to keep in mind is that the prevalence rate varies between states. In terms of the prevalence varying between states, there's a variety of reasons that could be impacting on that. Well, one of the, I guess, key considerations is that it may relate to differences in the diagnostic processes. In terms of prevalence, diagnosis of autism is more common, or the people that were recorded in the ABS statistics were more likely to be of school age. And that reflects that the age of diagnosis is sort of in young childhood, and the frequency of people being diagnosed in adulthood reduces substantially. Some of the other statistics in the ABS report was looking at the functional and participation impacts of autism. And this really provides some really strong statistics as to why it's important for us to be addressing diagnosis of autism to enable people to access the services that they require and the supports they require to increase their function and participation. So some of the statistics that were in there were around education. The statistics listed that almost all, so 97% of people in the survey had restrictions if they were in the school setting, and about 83% required some sort of assistance within that. There was also significant differences in post-school qualifications. So the rate of people with autism having a university or college qualification was around 1/4, which compared with other people with a disability and people without a disability, that sat within the 43 to 58% range. So there's substantially less higher education outcomes occurring. In terms of employment, there also seems to be restrictions around employment for people with autism, with much lower workforce participation rates. So looking at the statistics, we're looking at a 40% participation rate among people with autism, which is lower than other adults with a disability, which is at approximately 53%, and people without a disability, which is at about 83%. There's also, the report also talks about substantial difficulties with daily activities, in particular that people with autism have more restrictions and greater support needs, and these tend to cluster around the areas of cognitive or emotional tasks, which include making and maintaining friendships, social interactions, managing emotions, and also managing behaviour. And this affects approximately 41% of people with autism. There's also difficulties with communication, with about 1/3 of people with autism requiring assistance, and similar percentages for mobility, which includes community mobility, so going out away from the home, and self-care activities, so looking after personal hygiene and those types of activities. The last statistic in the report that I thought was quite interesting was that 58% of the population, 56% of the population had unmet needs in some regard. So why are these functional and participation restrictions important, and how are they related to diagnosis? At the moment, the way that the education, health and disability sectors are set up, to a large extent, having a diagnosis allows people to access various services that can help them to address these limitations in function and participation. Apart from that, the diagnosis is also helpful for service providers to guide what type of assistance would be beneficial. And there's also, a diagnosis can also help the individual and the family to help to explain so that they understand why their experiences have been as they are, and also help them to feel a sense of identity and to belong to the autism community. In terms of the current practice in Australia, there's been anecdotal evidence for a long period of time that there's substantial variation in how diagnosis occurs across Australia. The Autism CRC conducted a survey several years ago where they collected data from over 100 diagnosticians across Australia, in all states and territories, in regional and metropolitan areas. And they found variability in many of the outcomes and processes associated with diagnosis. There was wide variation in terms of who conducted the diagnostic assessments, ranging from single clinicians to multidisciplinary teams, where assessments were conducted, for example, in the clinic, in home, in community settings, what assessment tools were used and if standardised assessments were used at all, how much the assessment cost, and how long people had to wait for their diagnosis. The consequences of these variations in diagnostic practices is that there's an inequity that exists across Australia. People living in different states and territories, people living in regional versus metropolitan areas, even people living within the same suburb may undergo different diagnostic processes, which potentially may have different diagnostic outcomes. The system is also really confusing for consumers when they're seeking a diagnosis, with a lack of clear information across the board as to how to go about getting a diagnosis, particularly for people where they may be moving between states or territories. The other challenge is for health services, disability services and educational services, in that there is an inability to plan effectively for services because of the inconsistent statistics that come out of this process. The outcome from this was that the Autism CRC identified that there was a clear need to develop a uniform autism diagnostic process across Australia, and an opportunity presented itself with the rollout of the National Disability Insurance Scheme. A partnership was formed between the National Disability Insurance Agency, which is the government department that administers the NDIS, who have throughout the process committed to co-design and community consultation. The partnership is with the Autism CRC, which all of you are familiar with today, and having that objective of positive and lasting change, which I think that the delivery of the National Guideline for Autism Diagnosis will help to deliver. So in terms of this particular progress, I wanted to talk to you a little bit about what we planned and what we've done so far. So the purpose of our project is to develop Australia's first national guideline for autism diagnosis. This will be a written document that will be available for free download for any interested parties in the community, and this will be hosted through the Autism CRC website. In terms of developing the guideline, we've got some really important markers that we need to meet. Although as we go through the list, you'll see that some of them potentially are in conflict with each other. So it's a real juggle with developing the guideline. The first one is that it needs to be rigorous, valid and reliable. So with that, we need to know that the diagnostic process that we recommend is going to accurately diagnose autism, that people who come through the process with a diagnosis of autism have autism, and people who do not receive a diagnosis of autism don't have autism. It also needs to be accessible and equitable, and we're being very conscious through the process of looking at populations within Australia that traditionally have had difficulties with accessing services. We're having a strong focus on working with Aboriginal and Torres Strait Islander groups to make sure it's accessible and equitable for that population. We've also got a strong focus on regional and remote areas of Australia and trying to be innovative as to how we can meet their needs. The process needs to be acceptable to a whole range of stakeholders involved. It needs to be acceptable to individuals and their families, but it also needs to be acceptable for the clinicians who will be administering the assessments, and it needs to be acceptable to the funding agencies. The outcomes of these diagnostic processes need to fit in with the services that people want to receive. And within that, we also need to have something that is time and cost efficient so that it can be a sustainable program going forward. In terms of our timeframes, we're operating on some very tight timeframes with this project. It's a 12-month project overall. The initial phase of the project commenced with a literature review, and I'll talk about that a little bit shortly. As you can see on the time frame, that was the first few months, but it's something that continues as we go along. So as we're collecting new data, we're continuously going back to the literature to put those findings in the context of what is already known. We then have a phase of stakeholder input, which is the phase that we're very actively involved with at the moment. In terms of stakeholder input, we're looking at getting input from a very broad range of populations who are interested in the autism diagnosis process, and we're looking at doing that in a wide variety of ways. The input kicked off just before Christmas last year and will be continuing into the very early weeks of May. The next phase is preparing the guideline. So you can see from the timeframes that we've started with that. We've started to put some very preliminary ideas together that I'll present to you later in the webinar. And that's something that over the next few months we will be refining more and more, leading into a process where we get expert feedback, feedback from participants in our studies, and really refine that to make sure that when we launch the guideline in September this year at the Asia Pacific Autism Conference in Sydney, that we're confident that it's a solid piece of work. So in terms of who is developing the guideline, we've got a number of committees, as these types of projects generally do. The first committee is the Research Executive Team. So this is the team that is doing the bulk of the coordination of the research, analysing the information and writing up the guideline. The chair of this executive team is Andrew Whitehouse. I myself am the project coordinator of the team. Then we also have John Ray, Margot Pryor and Velsa Epen who are involved in this executive team. However, we also have a much broader group of people involved in guiding and providing advice and feedback on the development process. This is through our steering committee. We have a number of representatives on this committee coming from consumer and professional groups. I haven't listed off the names of the individuals, but we will have that available on the Autism CRC website shortly. But in terms of the representation, we have individuals with autism represented by ASAN. We have caregivers of people with autism represented by Autism Awareness. We have autism service providers and the consumers that they represent being represented by the Australian Autism Alliance. We have Aboriginal and Torres Strait Islander people represented by the First Peoples Disability Network Australia, and we have those living in rural and remote areas represented by the National Rural Health Alliance. We also have a wide range of service provider groups represented. We have teachers on our committee, primary healthcare nurses, clinical and educational developmental psychologists, occupational therapists, paediatricians, general practitioners, psychiatrists and speech pathologists. So the overall research question that we're exploring with this project is asking each of the stakeholder groups that we're talking to, from your perspective, what are the most important considerations to address when developing a national guideline for the diagnosis of autism in Australia? If we unpack that, what we're looking at is combining different viewpoints and perspectives from a wide range of people. We're wanting to know what the most important considerations are. And the reason we're looking for the most important considerations is that will help us to prioritise what to include in the guideline as things that need to happen and what to include in the guideline as things that would be nice to happen. And the focus needs to be on it being a national guideline that is applicable for all Australians, no matter where they live. The way that we're collecting the evidence is in several ways. So as I mentioned, the first step was a literature review. We also have a range of studies that fall under the umbrella terms of a Viewpoint study, a Delphi study and a consultation study. In terms of the literature review, the initial literature review report that we presented to our committees was an international scoping review. The focus of that review was to go very broad and basically collect up all of the information that was available on the autism diagnosis process in English-speaking countries in the Western world. So we looked at the UK and Ireland, we looked at Europe, we looked at America, North America, Canada and the United States, and we looked at Australia and New Zealand. The scoping review focus was not so much to refine in on specific aspects of the autism diagnosis process in terms of where the evidence base was. It was more about exploring what are all of the ideas that are presented and keeping that really broad. Within that, we looked at existing diagnostic guidelines. We also looked at academic literature on diagnostic accuracy with a particular focus on the DSM-5, which is the new diagnostic criteria. Much of the literature on diagnostic accuracy looks at the DSM-4. We also had a strong focus on including qualitative and quantitative studies on the experiences of the autism diagnosis process, particularly from the perspective of autistic adults and their family members of individuals on the autism spectrum. We also looked at factors that influence timeframes and waiting lists, and factors that influence the cost. So, for example, the hourly rate of people involved in delivering the services, the number of hours that a particular activity takes. Going on from the scoping review, the focus that we're currently involved with at the moment is systematic reviews, and that's where we're being much more rigorous at looking at the evidence that we collected during the scoping review and assessing the quality of the evidence and drawing out and identifying the strong evidence that we have to support recommendations in the guideline. The first of our studies is a Viewpoint Survey. The Viewpoint Survey is focused on identifying the perspective of consumers, and by that we mean autistic adolescents or adults and caregivers of individuals on the autism spectrum. And within caregivers, we have a very broad definition of that. So it's somebody who has been involved on an ongoing basis for more than about an hour a week. So it may include parents, spouse, siblings, other family members or friends. The way that we're collecting the information with the Viewpoint Survey is with a Q-sort method, which involves the participant taking 66 statements about the diagnostic process and putting them on a grid like the one on this slide here, from least important to most important. And people can move the statements around once they've got them in place. We've got several ways that people can do that. We've got an online program that is available through the Autism CRC website, the link is available there, that people can use on a Windows computer. But we also have alternate versions for people with Mac computers where they can do that in their word processor. Or we've got a version that people can print out, cut out pieces of paper and organise them on the desk and scan or post those back to us. This study we're currently actively recruiting for. We've got about 18 participants so far, but we would really like quite a few more participants with that. Ideally, if we can get somewhere in the range of 60 to 70 participants. So if you're out there listening and that's something that you think that you would be happy to do, on average it takes about 45 minutes, ranges generally from about 20 minutes to an hour for most participants to do that study. We would be really interested in hearing from you if you would like to participate. The next study we have is a Delphi Survey, and I'll just apologise, we've got an announcement over the PA at Telethon here. Okay, thank you. Sorry about that. So with the Delphi Survey, that's where we're going out to expert professionals. So the majority of people participating in this survey are diagnosticians, but we also have other service providers who are involved with individuals who are looking to go through the autism diagnostic process beforehand, or with people once they've had a diagnosis of autism. We've got a wide range of people represented in that group. So far we've had 67 experts complete the survey, and we've got a few other people who have started the survey. Within that, for example, we have paediatricians, psychiatrists, psychologists, speech pathologists, occupational therapists, GPs, nurses, social workers, I think we have, and teachers. So a wide range of people involved in that. And what we're seeking there is we're giving very specific questions to people and asking, do you agree, on a scale of 1 to 5? And what we're looking for is identifying the items where there is a strong agreement, very strong agreement that that should be included in the guideline. once we finish with round 1, we'll put together a new survey that will further clarify things that we're uncertain of, and that will go out in April this year. The next stage of the study is what was listed on as falling under the general consultation study. We're doing this consultation in a wide range of ways. What we're talking about here is the workshops. So the workshops we've had 4 workshops so far in Perth, Brisbane, Adelaide and Darwin, and we've got workshops coming up at the end of April in Melbourne, Hobart and Sydney. We'll also be running a teleconference workshop for people living in cities that we haven't been able to visit, or for those living in regional or remote areas, and details will be available shortly on the Autism CRC website. So far we've had 285 people register for those events. We've still got spots available in Hobart and Sydney if you're interested in coming along to those. Again, we're looking at mixed stakeholder groups for that, so autistic adults, caregivers of individuals on the spectrum, diagnosticians, service providers, policymakers, insurers, anyone who is interested in having their say about the autism diagnosis process. So far we've had the workshops we've been at so far, it's generated some really interesting conversations. People are really passionate about this topic, and we're compiling that information, and that will help to really guide and inform the process that we're going through at the moment. One of the things that we do at these workshops is we outline an example of what the guideline could look like and seek their feedback about what's good, what's bad, and how we can make that practical and workable. Another aspect of the consultation study is the online submissions. So this again is something that anybody can do. This study is hosted on the Autism CRC website on the project webpage, and it allows people to make an up to 100-word submission answering the general question of what are the most important considerations for us to address. So far we've received 110 submissions and we're currently recruiting. That will stay open until the end of April, so please feel free to jump on the website and have your say. As part of the consultation study, we're also recognising that there's not a lot of information out there about adults going through the diagnosis process. We have a research student who is particularly focusing on the adult perspective. So Matthew will be using the online submission data, but he'll also be supplementing this with a small number of interviews with autistic adults or people who self-identify as having autism. These interviews will take place face-to-face for those living in Brisbane if they would like, or they can be conducted by Skype or telephone interviews. So we'll be starting the process of recruiting those interviews in the very near future. My email address is at the end, so if you're interested in taking part, please feel free to get in contact with me. As part of the consultation process, we're also seeking a more comprehensive written submission from national peak bodies representing consumers and service providers, and these will primarily be the organisations that are represented on our steering committee, but we're encouraging them to seek input from other peak bodies who are also involved with their consumer or service provider group. The focus of those consultations will be around what are the most important considerations, but really drilling down to what they see their group's role is in the autism assessment process and at what point they should be involved in the assessment process. Okay, so in terms of what we've found so far, before I go ahead and present this to you, I really want to stress that these are based on preliminary findings. The information is still being, as I said, still being collected at the moment. Data analysis is continuing on. But what we've been doing is looking at the literature so far, looking at the early data that we're receiving and providing a bit of information for people as to where it looks like it's heading. If you think about it, I guess with the analogy of a picture, what we're presenting to you is a colouring in picture, and through the workshops, the online submissions, the interviews, the viewpoint surveys, will be filling in the content of these. So one of the things that with the guideline that we're starting to narrow in is a philosophical approach that we will be recommending in the guideline. So within that, some of the pillars are that the autism diagnosis process should be individually and family-centred, that it should focus on including individuals and their families as appropriate depending on age, as a source of information, as being involved in determining the pathway that people go down, and in terms of the communication strategies. We also recognise that there should be a focus on strengths. So rather than just focusing on a deficit model that is presented in the diagnostic criteria, we should also be looking at what abilities, skills, attributes, and potential the individual under assessment has. And the last pillar is that it needs to be evidence-based. So we need to have research evidence to support that, that what we're recommending is going to present an accurate and acceptable diagnostic process. In terms of the assessment scope, when we started the project, the scope was quite narrow in terms of confirming, does this person have autism, yes or no? Through the process so far, we've realised that we needed to expand the scope to also include a more holistic assessment that looks at identifying somebody's support needs. What we're looking at doing is having two parallel processes that overlap in various places where the diagnosis is confirmed, but also that the person's support needs are identified and they're referred on to the appropriate support groups. And that this in total will describe the autism assessment. Another aspect that we've been looking at is the assessment structure. So in trying to balance maintaining short waiting lists, low costs, making it equitable and accessible to people, whilst also balancing that out against having an accurate assessment process, we've started to look at a tiered system. Again, exactly how this will work is still being investigated and explored, but one of the things that we're looking at is a cumulative tier approach. So what we're suggesting is that all people who are referred as eligible for an autism assessment or screened for an autism assessment would initially have a tier 1 assessment. This would be conducted by 1 or 2 clinicians. We're still establishing how that would work, and they would have a simplified assessment process. For those individuals where there is a clear diagnostic decision that can be made after that first assessment, the autism diagnostic assessment process would be completed. So this is if they've clearly, yes, got autism, or clearly, no, they don't have autism. So the diagnostic assessment finishes at that point, but support needs assessment continues as required, and through that process they're linked into the appropriate services. For other people, diagnostic uncertainty may still be present after that simplified assessment process, and that's where we're recommending that they go through to a tier 2 assessment, which is tailored to the individual's need according to the areas of uncertainty and ambiguity, and that would be a much more comprehensive assessment conducted by a multidisciplinary team, and that would include more detailed and thorough assessment, particularly through the use of standardised instruments. One of the other things that we've been exploring is around assessment settings. So we're getting really clear feedback that we need to be collecting information from multiple settings. This includes different locations, so for example clinic versus home versus community, and that there should be different information sources, so for example the individual, perhaps their parents, their teacher, previous service providers. We're still exploring the practicalities of how we can make sure that multiple settings are addressed but still maintaining the costs. And we've had lots of discussions around where telehealth may fit in with that. Within that, there's a recognition that the assessment settings need to be individualised. They need to be set up to address unique access barriers that people may have. And we need to set that up so that we have a good combination of people being observed in a comfortable environment, but also allowing the assessment team to create evidence of where people are experiencing challenges. In terms of how the information is collected, we're suggesting that there's not a single source of information, so a single assessment that everybody should do and that provides all of the information required. What we're saying is that the guideline will consist of several strategies that work in conjunction together, and these fit into the general categories of interviews with the individual and the caregiver, observations of the individual undergoing assessment, potentially medical evaluation, file review of previous medical, schooling or other records that are relevant, perhaps the use of autism-specific diagnostic tools or other standardised assessments. The final aspect of that is where we're getting some really clear information is about how the information on assessment outcomes are shared. And we're getting really clear information that this should be presented verbally to the person, preferably in a face-to-face meeting, and then followed up by a written report. And the style of this communication needs to be supportive and compassionate. It needs to be easily understood by a wide range of people who may be receiving that information. It needs to be informative and have the adequate evidence covered, but it also needs to be useful. So the people reading the report need to be able to take that information and translate it into support being provided for the individual where they need it. The types of topics that need to be covered are the needs and challenges the individual has, the strengths and resources of the individual and perhaps their network around them, a definite statement around the diagnostic decision, and recommendations for further assessment and support services. Okay, so that brings me to the end of the presentation. I wonder if anyone has any comments or questions. I think Cheryl was going to coordinate that process from her end. Okay. So are there any questions there? Okay, so I've got a question here. So will the viewpoints of actual autistics be considered to have more weight than those with autism than people without autism? Within that, we haven't developed a framework for weighting the evidence. What we'll be doing is each of the studies will be written up independently as peer-reviewed journal articles. So the findings from those studies, so some of the studies are focused more specifically on autistic individuals and caregivers, in which case their findings will be presented in their entirety in those reports. As I said, we've got somebody focusing specifically on the perspective of autistic adults, and their thesis will be purely from that perspective. So the information from the different stakeholders won't be diluted and combined. So we're not providing any different weighting. What our sincere hope is that once we collect the information from the stakeholders, there's actually consensus there, and we're not in a situation where we're having to weigh evidence from one perspective from the other. And certainly from the workshop so far, we haven't come across any conflict between the different stakeholder perspectives so far. So, and particularly with the workshops, one of the things that we're focusing on doing is having mixed stakeholder groups. So autistic adults, parents, grandparents, service providers, diagnosticians in the room together. We're actively trying to, when we do the table settings, we're actively trying to put mixed groups together for the small group discussions so that people can have these, hear each other's viewpoints and come up with solutions that that are agreeable to everybody. And we've had really positive feedback from autistic adults who have participated in our workshop so far that despite some hesitant and anxiety about going into the workshop, that their perspective would not be heard, or that the conflict might ensure, they've been really happy with how that's worked. And we're very, with the workshops, we're very specific and explicit at the beginning when we do our introduction that everybody is walking into that room as an equal, and we're interested in hearing everybody's perspective.
Thank you so much, Kiah. It's really incredible, and it's an incredible thing, I think, for an organisation to take on in terms of looking at a national guideline, because this kind of work and this level of consultation with the community, engaging people on the spectrum, as far as I know, actually hasn't been done before. Yeah, I think with our workshops in particular, I guess the comparable thing would be focus group studies, and yeah, just the numbers that we're getting with that. We've had so much interest from the community. That's fantastic. Kiah, I have a question from the audience. Will this guideline support mature adults to access diagnosis? A little bit earlier on, it seemed like there was a little bit of an emphasis on children and adolescents. Yeah, sure. Absolutely. So this guideline is for people of all ages. So whereas some of the international guidelines focus just on children, or some even focus on very young children, this guideline is for anyone of any age where an autism diagnosis is suspected and needs to be explored through the diagnostic process. We will have, as we go through, so we're actively exploring what are specific issues for adults. Within that, we're also very aware of gender being a particular issue that impacts on presentation, particularly in adulthood, because once people get to adulthood, there's a range of strategies that they've had in place to cope. So if they've not had a diagnosis up until that point, they've got strategies in place to cope with any functional limitations they may have, or any participation restrictions. So we're very aware of that needs to be a detailed process. We'll have sections of the guideline that address adulthood in particular, and not just talking about young adulthood either, so through the lifespan. And we're certainly encouraging anyone with expertise, either from lived experience or professional expertise, to put their ideas forward to us through the different mechanisms that we've got, so that we can include those suggestions. Thank you. Kiah, another question from the audience. Will the guideline have an impact on costs and waiting lists? Yeah, so that's something that we're specifically hoping so. We're hoping that it will make the costs and the wait times more consistent and smaller as much as possible. So we're very aware of doing economic modelling to look at different models, so different potential assessment processes, trying to do the maths on how much is that likely to cost. So we've got some figures that we're using for hourly rates for different health professionals. So trying to look at keeping the costs down as much as possible, and in terms of timeframes, looking to any ways that we can use to make the process more efficient, so that we can reduce the wait times, and within that also looking at building in processes that while people are waiting for the diagnostic process to happen, that concurrently they're being diverted through to service provision. So we're not recommending that they go through our the diagnostic process that we recommend and then start treatment. We're suggesting that at the point of referral, they're also referred to services and supports to address their most urgent needs. Fantastic. Thank you. It sounds like, because you're consulting so broadly and you're engaging so many stakeholders in it, you're kind of looking at this as a very comprehensive approach to diagnosis and service provision at the same time. And another question from our audience, are you anticipating that the guideline will be mandated at some point?
Okay. So in terms of the immediate outcome, it won't be mandated straight away. As you can imagine, something like this takes a long time for it to get to a level of being mandated. But what we do know is that you know, we're working very closely with the NDIA. Although we're working independently of them, and very much the outcomes will be based on the evidence that we're collecting through our broad consultation and research studies and the literature evidence base, we are checking in with them regularly to make sure that the structure that we're putting together will fit with intake into, for example, the NDIS. We'll also be talking over the next month with health and education settings as well to make sure that that the information is usable. So we can't guarantee that it will be mandated, but it will certainly very strongly be encouraged, and we're expecting that it will be the benchmark for accessing to services.
Yeah, absolutely. It's an ambitious goal, but an important one.
Yeah, and then down the track, hopefully, you know, that's something that may progress.
Yeah, absolutely. I think it's something that the CRC will certainly be advocating for very strongly. So it was really positive to see, Kiah, that one of the guiding principles that are emerging from the findings, not just from the hunches of the research team sort of leading this piece, is that focus on strength and how important it is. You know, we heard this earlier in the week with Jackie Den Houting's presentation on neurodiversity movement, and how important it is that newly diagnosed individuals actually receive positive messages of support and affirmation at the time of diagnosis. And it's very heartening, and it makes me very proud to be part of the CRC, to see such a commitment of the team in actually engaging the autistic community and including key stakeholders such as the likes of the Autistic Self-Advocacy Network and other organisations that have really deep relationships with the community. So we might we might conclude that. I guess the other thing to note is, of course, if you're listening to this webinar and this is the first time you've heard about this project, we would absolutely love to hear your thoughts and around the diagnostic process. So please log on to the CRC website at the Get Involved section, and you know, put your views forward, attend one of our consultation workshops, come and be part of the conversation, and certainly take part in the online survey. So thank you so much for joining us today, and thank you, Kiah, for such a comprehensive overview of this important research initiative, this really important policy initiative, really. The recording of our webinar will be available on the Autism CRC website in coming days. That concludes our Autism Month webinars, and we want to thank all of our speakers and to the community that have listened this week and downloaded the recordings. If you would like to know more about the Autism CRC's work in both diagnostic practices but also across the lifespan, please go to our website on autismcrc.com.au, where you can sign up for our news, research updates, and even participate in some of our studies. Again, you can log on to the section around Get Involved and find your way to the diagnostic guidelines to be specifically involved in this consultation process. We also invite you to follow us and look us up on social media. So thank you once again, and thank you, Kiah.
Thank you.